It's a pretty well established fact that one man dies of prostate cancer every 45 minutes in the UK. And of course, there's countless more that get diagnosed with prostate cancer. In my case, I had some early indications of prostate trouble, although at the time I didn't realize that it was prostate trouble. I visited my GP, had some very good response and service from the GP. Um, the, um, the early symptoms were fairly common in men of my age, and at the age I was in the early 60s. I was relatively fit, healthy, had a reasonable lifestyle, but was found I was increasingly having to get up during the night to go to the bathroom, and having some fairly recurrent infections, bladder infections that were very, very uncomfortable. But with treatment, with antibiotics, with frequent checks, I got through a lot of that. But then it still manifested itself in having to use the bathroom quite frequently. And the interesting thing about the persevering with the diagnosis is that you don't actually feel that it's getting any worse, because it's a constant sort of degeneration of the situation that one day is very much like the day before, or the month before, or the 2 months before. And it just got to a point with me that I thought, well, this doesn't seem to be getting any worse, but I better get it checked anyway. And went to the GP, had a blood test literally on the Tuesday, and had a call from the doctor directly on the Wednesday to say, I think you need to come in and see me. And it was the PSA test that had gone from a relatively normal figure to a very high figure in a very short period of time, because I had PSA tests every 12 months before that, just to keep an eye on it. So it had accelerated quite badly, increased quite badly. So again, went to Kim's to visit Kim's, and saw the surgeon there, and then went through the series of further tests to finally diagnose through an MRI scan and a biopsy that indeed I did have a tumour in the prostate. And then to be told clearly that I had cancer, and but there were several things that they could do about it, and went through the surgery some 2 to 3 months later, which was 2 years ago. November the 5th was the day of the surgery, which is pretty difficult to forget. So, and very relevant to men's health in November as well. Although it wasn't planned that way, it seems to have turned out that way. But I think the importance of the message really is that once there are symptoms seem to be there, or there are certain characteristic things that happen to men, is to get it checked. Because it doesn't take time to get it checked. Whatever the check is, it's a self-check, or it's a blood test, or it's a physical test. But it really isn't that difficult to do that. And many cases it's not cancer. Many cases it's treatable in other ways. But if it is cancer, best to get it done as early as possible. And since the awareness, I do know men of younger than I am, younger than that I was when it was first diagnosed, that haven't been to get it checked, and unfortunately have lost their lives through it relatively quickly as well. As men get older, it's almost half expected that it's going to happen, but certainly in men 10, 15, 20 years younger than me, it's a dreadful thing to find that you've left it too late.